experts with some of the content team here at Geonetric. We're going to answer real questions that we received from today's webinar attendants. So let's get started right away with the first question. How do I sell the value of a content project internally? First, make the case for investing in high quality content. You can do that by educating your internal stakeholders about the value of content. Remind them that content is the key to a successful website and one of the most important elements of SEO. And that clear, relevant website content with keywords incorporated connects your organization with its target audiences. Second, promote a website content project as a solution to organizational frustrations. If you think about common internal stakeholder pain points that prevent your organization from meeting its business goals, and also maybe identify service lines that need to grow with their patient volume. Website content can help solve these problems. Make sure to focus your efforts on the content that is most aligned with addressing these problems. Now, developing content that answers visitors' questions and encourages engagement with your organization and services can be the answer to some of those problems. If there's still resistance from stakeholders to a content project, give them the option of choosing between a few content project levels. At Geonetric, when we start a content project, we refer to our efforts as refresh, revise, or create. And these levels, if you offer them to your stakeholders, will give them more control of the time and cost factors involved in a content project and may make them feel more at ease approving a content project. Another way to sell content is to show results. So if you've written website content recently, you can use your Google Analytics account to measure your content's impact and prove the value of a content improvement or development project. Then you can also review a competitor websites, and compare your organization's content and key service lines. So this will give you a baseline to determine if you need to revise or create new content to describe your unique and specialized services in different areas. If you have a patient and family advisory council, ask them for feedback about your website. They're a great source of information because they are current and former patients with real experiences with your organization. And finally, you can survey your website. You can do a survey on your website to ask your visitors about your content. You will get plenty of insight about how your current website content does or does not meet their needs. This is real feedback from your website users and can smooth the way for a project. We also encourage you to use the content resources on Geonetric's website to help build your stakeholders' knowledge about the value of good website content.
Hi, I'm Erin. That was a great intro from Shelley about selling your content internally, but understanding what content strategy is to help understand where you need to go next is a really great question as well. So our next question comes from exactly that. What's the most reasonable way to get started on a content strategy if your organization doesn't have something in place? Now, there are many definitions of content strategy. An industry expert and author, Christina Halverson, uses one that says content strategy often means getting the right content in the right to the right people in the right place and at the right time. And it used to mean editorial calendars. So we would kind of schedule when we'd publish information. But in this world of strategy has gotten much bigger these days. Content strategy is words on the page, and it is navigation experiences and how it looks to the end user. But it also considers when content is published and where. It also considers navigation and taxonomy, how content relates to each other and is connected, and making it easy for people and search engines to find. Content strategy also has to consider the governance and maintenance of content. So making sure that it adheres to a brand voice and style, and that there's a workflow for regular publishing and updates to content so it stays valuable and insightful to your users and search engines. So that can be a lot to digest just off the top. So if you're new to content strategy, at its core, you want to start with your content. And you're going to learn more about this from Celine here in a minute. What you have today, what you need, what on your content maybe needs a little bit of TLC, some tender loving care. And again, kind of referring to that refresh and revise part of the process. And of course, before you decide to tackle content strategy, it'll help to know where you're trying to go. So talking about your organizational goals, the content goals themselves, where you want to fill gaps, and understanding your true audience. What are they looking for? What type of information are they seeking? Understanding the needs of real users, including their pain points and obstacles in finding healthcare content, can be a great way to start honing in on a strategy that everyone can back. Likewise, knowing your internal goals and resources is important. So take a look at your team, take an inventory of the skills you have. Is there anyone that can provide writing assistance or content development? Are there folks on your team that are good at navigation and taxonomy structure, even ongoing maintenance or building relationships with stakeholders that can help support your growth and your strategy? Documenting all of this information, all of your findings and decisions, helps keep everyone on the same page and keeps that consistent purpose going forward. And at that point, you can start digging more into what we're going to be learning in today's webinar, starting with the actual content on your pages.
All right, hi, I'm Celine. Our next question was, many of our web pages haven't been updated in years. How do I start the large task of refreshing them? So once you've developed your content strategy according to the guidance that Erin just shared, you should have a good idea of what content is currently on your website and what content needs or doesn't need to be on the site. At that point, your next step is to prioritize specific areas of content for updates, creation, or deletion. This will help break up the large project into manageable chunks and make sure the most important work gets done. And as you determine your priorities, you'll want to consider the organizational goals, the stakeholder needs, and the audience needs that you identified when developing your content strategy. You'll also have to think about your team's capabilities for handling the work and where you might need support from your web vendor or an agency with experience in your type of content project. Finally, make sure to document your plan and timeline for handling each area of content so that everyone on your team is on the same page and you can track your progress.
Hey there, I'm Stella. So our next question is, how do I get the most valuable information from stakeholders? And as healthcare marketers, every day we're relying on stakeholders to help us understand our organizational priorities, the competitive differentiators that we want to communicate to our target audiences when we're talking about the services we offer, other important goals and themes. So having those conversations with stakeholders is really a critical part of starting any successful content strategy initiative. So my main recommendation is to prepare. So prepare your questions ahead of time. Tailor those questions when appropriate to the role of that stakeholder that you're planning to interview. So for example, if you're talking to someone in your HR department or who is involved with provider or nurse recruitment, the questions you ask them should be tailored to that role. So talk about the benefits you offer. What are common questions applicants have when they're going through the process of applying for a job, through that hiring process? What are these hard to fill positions that they're trying to target specifically? Things of that nature, and you'll get good quality information out of that conversation. So we here at Geometric always prefer to have a phone or in-person interview. That's because in the moment you can ask follow-up questions or really dig into something that a stakeholder has said. We usually try to keep those interviews, phone or in-person interviews, I should say, between up to 3 to 5 people at a time so it doesn't get too unmanageable or unwieldy. I usually like to start the conversation, especially if we're on the phone, by asking the participants about their background, their history of the organization, what they care about when it comes to content, their goals for the content project, what will mean success, and other questions. And it's also a great way to be able to identify voices as the conversation goes on over the phone. But however, if you want to get information from a larger group, or we're all busy, and I'm sure your stakeholders are busy too, if schedules are a hindrance to scheduling a phone call, an online survey may be the best option for the case at hand. So when you send out an online survey, make sure that you're always asking for the participants' email or contact information so that you can reach them if they have a follow-up, if you have a follow-up question about something that they've shared. Another thing to keep in mind that can be a little touchy is that a stakeholder or a subject matter expert, they may be an expert in their field, and that's why you want to interview them for information. But they're not necessarily an expert when it comes to marketing or online content strategies. So that's why getting your information from a stakeholder or SME is important, but having a trained web writer who can interpret that information and tailor it for online audiences and their purposes, as well as your organizational goals, that's going to be critical. Another great way to set up your project for success is to communicate the value of the interview and your content project at the introduction of your call or in a little piece of introductory copy before the survey. So, for example, if your organization is really making an effort toward better user experience on your website and more patient-friendly content, make that clear in that introduction so that the stakeholder can best prepare and focus on that kind of angle with the strategy you want to take.
Okay, we got a few great questions about finding reliable sources of information for creating health content. So to answer that question, I'm going to share some of the resources that we use here at Geonetric when we're doing content development projects. If you work for an organization that employs health professionals, start by asking them for information using some of the tactics that Stella just mentioned. When we need to do research on the web, we like to use .gov and .org websites for authoritative, trustworthy information. So for example, the National Institutes of Health website listed there offers a hub where you can browse or search for a wide range of patient-friendly information available on various government health websites and all kinds of topics. I also sometimes use the websites of professional organizations that publish educational information for patients and other non-professionals. That American Academy of Orthopedic Surgeons website is a great example, and there's lots of articles there about various treatments and procedures. And if your website has a health library, you can always use that to inform your writing as well. I do recommend that you cite your sources of unique information, like a finding from a research study by a certain organization, for example. And I would be remiss if I didn't remind you of what we all learned in school about not plagiarizing. Unfortunately, I have seen some websites with paragraphs of copy that had just a few words changed from text on another website, which of course doesn't cut it. If you're writing about an unfamiliar topic, I suggest that you research it from a variety of sources until you feel like you fully understand it, and then start writing from scratch. Then once you have your first draft, you can go back and check what you've written against your sources to make sure it's accurate. That will reduce the likelihood that you'll end up copying someone else's wording, even unintentionally.
Plagiarizing is bad for your SEO as well as being unethical, and there's a lot of great free online plagiarism checkers that you can enter your content into to make sure that it's as unique as it needs to be.
Absolutely.
So let's talk about improving your customer experience and organizing your content in a way that's logical to your end users. So something to keep in mind is your website or your e-newsletter, any piece of content that you create, it's not for you as the creator or necessarily even for your organization. It's for your user to consume, to learn, to engage with. So I challenge you to always think about how a person who has zero healthcare experience or understanding of how your organization works and the processes that are in place, how are they going to view that content? Is it going to make sense to them? So something we at Geonetric have always considered best practice, but in the last year or so, we've really strengthened our strategy around is our understanding of the patient journey and how it relates to the concept of consumerism. So the patient journey, as you can see in this visual here, it's the overall experience that a consumer has from the first time they connect with your organization through their care, through discharge and follow-up care. So the patient journey is more than just your website. It includes your social media presence, any email or marketing automation efforts, traditional marketing like print advertisements, and all of your content marketing. So basically any point with a person or electronically that someone can interact with your organization in any way. And you can think about the great customer experiences that customer-obsessed brands like Amazon and Netflix offer. People are increasingly expecting that level of a personalized experience with the organizations that they interact with, including healthcare. So an activity that you could engage in is called patient journey mapping. This is a specific exercise that allows you to understand the sequence of events that a patient experiences before they enter in the healthcare system, through their entire experience, through discharge, and through follow-up care and survivorship. It identifies all of the non-clinical as well as clinical interactions between the consumer, their healthcare providers, other staff members, as well as any interaction that you've automated through your website or patient portal. And doing this exercise allows you to investigate your customer experience to make it as human as possible. You can see where there are gaps and opportunities, where you can increase and optimize touch points with patients in your customer experience or your marketing funnel. In addition to patient journey mapping, you could consider developing personas for the target audiences that you're trying to reach. That can help you understand the needs of the specific people that you're trying to communicate with. Something else to consider would be to conduct a UX or user experience audit, which is something we can help with, that analyzes existing user behavior on your website, your existing content, design, and digital presence in order to really evaluate your user experience and then find those gaps and opportunities for improvement. Something else to consider that we're a big fan of here is to consider user testing. There are a lot of different approaches to conducting usability testing, but having that data from how real users are interacting with your site, that is extremely valuable. Another tip for improving your user experience is to leverage your content management system or CMS effectively. And Erin did a great job setting up the concept of taxonomy and how that relates to content strategy in the first question that she answered. So, for example, at Geonetric, our CMS Vital site allows for dynamic cross-promotion of related content through smart panels, which supports your target users' understanding of the breadth of services you offer. It helps them more intuitively and easily navigate across your website. What that means, or what that can look like, is that on a service line page of content, smart panels are dynamically showing providers, locations, related classes, and events so that a user can find what best is relevant to them at that specific point in their journey. We also work with other clients who have other CMSs besides Vital Site, and we help them work within their CMS to create the best possible user experience. Another important aspect of your user experience would be your calls to action, or CTAs. So every piece of content that you're creating and distributing should have some sort of action that aligns with user needs and your business goals attached to it. So make sure that each call to action is as relevant as possible to that piece of content in question and where the user is in their journey at that time. What is the next step that you want them to take? Really try to keep that top of mind.
Okay, the next question is, our health system acquired a new hospital. How do we integrate its content into our website? This is a question we hear frequently from our healthcare clients. It's such an overwhelming task to some clients that they can't decide where to start, so they come to us for help. At Geonetric, we refer to this as shifting from a silo mentality to a system approach during the content strategy phase of a project. And that means we help our clients organize information and present it as one integrated healthcare organization rather than having divided entities. When you move away from data silos, you'll be presenting website visitors with easy to access, comprehensive information about your system. So system approach benefits for your organization would include being able to leverage your system size and scope to your competitive advantage. Also creating more internal efficiencies and less redundancies and duplicate content. And then also making it easier for consumers to find the care that they need on one comprehensive website. That benefits your users as well as you because you're providing a better user experience, what Stella just talked about. And then with fewer internal barriers, your organization will be able to put an even greater emphasis on delivering that high quality patient care. That's all of our goals. So the second thing you can do to move past the silos is analyze and assess all the content that you have. And that means performing a content audit. Erin talked about this earlier, but just to recap a little bit, a content audit helps you understand what content you have. And also Celine talked about this as well. So you'll be very clear on content audit by the end of this webinar. But again, getting back, so you'll understand what content you have on your existing site, where the gaps are, and then where you might want to combine content as well or create new content. Then next, taking a deeper dive by involving your internal stakeholders and your acquisition stakeholders to get a complete look at the similarities and differences of your goals, audiences, and the content that you have. And that'll set you up for success going forward. Be sure to take time to align assets and identify opportunities during integration. So if you're talking to both sets of stakeholders, this will help you decide where to focus your content strategy efforts during your shift from that to that system-wide content and locations and providers as well. And then don't forget to develop new content around unique services and location features. You don't want to lose those differentiators during the integration that one hospital may have over another. So keep those in mind as well. And sometimes that might include developing new content about those or refining the content that you have to make sure those unique services and location features are included. So all your efforts will come together in the end. You'll be able to use the strength of your brand and the depth of your content to present a unified, seamless user experience on your website.
A question we get pretty frequently from clients and that participants in this webinar asked us was, how do we know the content topics that will appeal to our audiences? So you have to first start with identifying who are those exact people that you want to reach. Think about their unique needs and what's most relevant to them, as well as the action you want them to take when they read a page of your content or open an e-newsletter. It can be helpful to dig into the demographic data in your target geographic area, or I've seen a lot of great information come out of community health needs assessments. That's a great way to understand the people you're trying to reach. What are their concerns? Another great clue to understanding what folks are interested in is the user behavior on your website. So what are they entering into the search function of your site? What are the terms or topics that they're most interested in? Are there blog posts or certain pages of content that have really high traffic that you could consider expanding your content assets around? Another tip from us is to conduct keyword research into your area using tools like Google Trends and AdWords, which are free for data. So what are the search queries that folks are entering into Google and other search engines? What are the questions that they're asking that you can provide an answer to with your content while also positioning your brand positively and as your organization and your providers as the best choice for care? You should also keep your finger on the pulse of national and local trending topics in healthcare. So this is something that we talk about when we discuss content marketing, which is the idea of newsjacking. So if something is in the news, if there's a lot of press or publicity around a health topic, that could be a good thing for you to cover and how your organization sees it or how it relates to the services you offer. And as we mentioned before, always consider the patient journey. So think about the emotional state of the specific user that you're trying to reach. So if someone is feeling anxious versus someone who is feeling curious and optimistic, you want your content to reach them where they are. And all the research we've seen shows that always having a positive, supportive experience with your content, that helps your users feel reassured so that they're able to take that next step. They're more likely to convert or sign up for an appointment because they feel reassured by your content, tone, and voice. So don't scare them.
I was just going to add too that Google Trends, you mentioned, is free, and it is free. You can actually browse by topic. So if you want to see what types of healthcare related topics or news, oftentimes things that reach into the news, especially national news, will trend on Google Trends in the healthcare category.
Yep.
But that's a really great way too to see at a high level what healthcare topics in general are trending across the country. And then you can drill down by region too. So it's a fantastic tool that healthcare marketers can really use in their toolbox.
Yeah, thank you for saying that. Something that jumped into my mind as you were talking about that too is that if you work for a specialty clinic or a health system in your area, leverage Google Alerts. So you can sign up for an email in your inbox every day that has basically the top headlines from around the web about those topics. It's a great way to monitor the conversation and to learn new things without having to spend all that legwork searching yourself on Google or your preferred search engine.
All right, how should I improve my ability to write in different tones? So it's hard to change your voice and tone when you change your writing style and audiences, whether you're going, as this question was asked by someone who goes back and forth but with technical writing and writing for the web and other types of content. So in our experience writing for over 60 hospitals and healthcare systems across the country, we have to change the voice and tone often to fit those clients that we're working with. A well-established style guide helps us do this. We recommend that you document your organization's voice, tone, and style guidelines and use them when you are writing. And I know some people, some organizations do not have that in writing. So if you don't have a voice, tone, and style guide, think about creating one with with input from your internal stakeholders so that you know what your organization's voice and tone should be, and then make sure that you use that, as I just said earlier, when you're writing. Also, to help you make that guide, you need to know who your target audience is on your website and who you're writing for. So if you have personas, that can help with that as well. Read articles and blogs with a similar tone of voice to the one that you want to shift to. So if you've been writing technical information for a couple weeks and now you need to go back to writing something for a patient audience on your website, this helps you get in the right frame of mind and just makes it flow a little bit easier. And then practice writing using your established or new voice, tone, and style. That always helps the words come easier as well when you're writing for a website audience. You can also follow our best practices for web writing, which includes focusing on using clear, plain language that people with all levels of health literacy can understand. And Stella will talk to you about that a little bit more coming up. So when you put a brand together with a well-defined voice and tone, you'll have a powerful message to reach your audiences.
What's the best way to write concise, valuable headings to reach my audience? So we had quite a few questions come in around this topic specifically. So for example, if you're writing a page about heart surgery, what are the type of subheads and H1s and H2s that you should use to resonate with the questions that real people have about the services you offer that are also supporting a healthy SEO? So headings are valuable because they help users and Google understand what a piece of content is about. They support scannability by breaking up your content, and I'll show you an example in my next slide about how that really works. They also support accessibility. So if someone accesses your website using an assistive device like a screen reader, that piece of technology is really relying on those headings in order to communicate what that page of content is about to that user. Headings can help you organize and break up a piece of content so it's more consumable for online readers. So we always recommend being concise but informative. So a heading should really describe the paragraph or piece of copy that it precedes, so a user knows what to expect. When you write headings, be concise and conversational, and try to incorporate keywords naturally for an SEO boost. And always try to keep the mobile experience top of mind. So if a heading is too long, it could get broken into 2 or 3 lines. Here's an example of a page that really isn't using headings as effectively as it could. So right now, this page of content covers several topics, like the definition of low vision, what are the causes of low vision, and other topics. But you really wouldn't know that if you just landed on this page. You would have to read the copy very closely to understand what this page is about. And today's readers, today's online users, they don't have time for that. So on the right, you can see a version of the page that makes more effective use of headings, as well as other tactics that we here at Genetric consider best practices to support scannability and effective online consumption of our content. So including headings, you'll see some bullet pointed lists there, a little call out on the side. As you can see, it's much easier to know what this page covers and then find the information that's most relevant to the user's unique needs. Shelley did a great job teasing this topic a little earlier, so we get this question quite often as well. So what is the grade reading level that I should be writing to? And generally, our team recommends around an 8th or 9th grade level, but there are a lot of factors that you should consider to inform the grade reading level that's going to be right for your target audiences and for your organization. And that's something that you should document in your style guide. So health literacy is different from general literacy. General literacy is the ability to read, while health literacy is the ability to find, process, understand, and make informed choices using health information. So if your users can't understand your content, they may leave your website and look at your competitor site. The University of North Carolina at Chapel Hill has this really fantastic interactive map of the United States where you can look at health literacy, specifically health literacy proficiency across the United States, by state, and even drilling down into specific counties. So while we recommend at a baseline 8th or 9th grade reading level, if you really start analyzing the data you see in that map and the counties that your organization serves have low levels of health literacy proficiency, you may want to consider lowering that target grade level appropriately so that the people that you're trying to reach are able to understand the content that you're writing. Writing at a grade level that most people can understand is also an important component of meeting federal guidelines for accessibility. So the Web Content Accessibility Guidelines of CAG, part of making your site accessible is having content that is understandable to the widest audience. If there's a high number of people in your target geographic service area who speak English as a second language, that may affect the grade reading level that you want to aim for. So simplified content that's written at an 8th grade level or lower is more easily and accurately translated by translators and apps that live within their browser and their phone. On the other hand, say you're writing to a professional audience of experts in the topic at hand, you may be able to get away with writing at a 9th or 10th grade level, but always keep in mind that audiences of all expertise levels, we all appreciate simplified, scannable information on the web. A great tool that we use pretty frequently here is called HemingwayApp.com. It's a free tool where you can go online and copy and paste some content that you're working on into the app. It'll give you a grade reading level of that content and then suggest some ways that you can reduce that grade level and make your content a little more concise and clear. So we deal with complex language and medical jargon every day because of the field that we're in, and that can be challenging when we want our content to be as accessible as possible and to reach the largest audience with our message. So that's something that Celine will address in our next question.
Great. Thanks, Stella. So our next question was, how do we describe advanced medical procedures in a way that's simple for patients but complex enough for physicians to impress their colleagues? So you should always prioritize your main audience, which is patients in this case. If you write about a procedure that's in a way that is understandable for them, they're going to feel more comfortable getting that procedure at your organization. And that will ultimately benefit the physicians too, because they may end up with more patients and better informed patients. The person who asked this question asked specifically about using long technical terms for medical procedures. An example I can think of is transcatheter aortic valve replacement. It's okay to use long technical names like that if that is the official name or the most common name for the procedure. That may be the term that the physician uses with their patients, and if patients see that term on your website, they'll be able to recognize it as what their physician talked to them about. But for ease of reading, you may be able to abbreviate the term or use simpler alternative names for the procedure on second reference. If you've researched your area's health literacy level using that tool that Stella just shared and done some keyword research, you'll be in a good position to determine the right terms to use for your target audience.
Which drives right into the next question, which is a good one. So how do we balance content that drives actions, like appointments, with content that provides information, like wellness tips? And this is a really great question. And to the person who asked this, if you're out there, I really like that you use the word balance, because that's very, very key here to developing an effective strategy. First, every piece of content you create should be actionable. So whether you're encouraging someone to visit your wellness center after reading a healthy recipe, or you're hoping that they schedule an appointment with your imaging center after promoting mammogram services, you should be driving that next step with that call to action. The standard sales and marketing funnel echoes a lot of the patient journey that Stella talked about earlier, and it can make any action at any stage in their journey. So their journeys differ. For example, my father has diabetes, and as a child, or his child, and someone who wants to help him live a healthier life, I might want to find tips on how to help him live a healthier life or eat better meals, or maybe I'm ready to make an appointment for him to see a doctor. So my stage of the journey would be very different things, but I'm still interested and hungry for some of that information. Though the word blog often stirs up feelings of the 1990s, blogs and content marketing hubs are still essential assets for brands to connect with people. And so all different industries are doing this, but it's especially helpful in healthcare. And according to demand metrics, content marketing generates 3 times as many leads to your door as outbound marketing. And that's because it nurtures the journey of the consumer and solidifies your brand experience as a trustworthy source of healthcare knowledge and care. So whether it's a blog content or foundational website services content, you'll want to audit it all to see what you have and what's missing. Again, harkening back to that content audit. Free tools like Google Trends can help you browse topics in your region and see what questions and topics people are interested in. Your local news, as Stella mentioned with newsjacking, is a great place too. And also leveraging social media to actually have conversations with your followers. Ask polls, ask what's interesting to your followers on social media. That's a really great way to build meaningful topics and inspire content that real people are looking for. And all of this research really should be part of every piece of content you create in your content strategy experience. And related to social, since we're on the topic, the elusive social media puzzle, another great question. How often should I update the content on social media? And the short answer is there's no perfect number. And I know that's probably not what you wanted to hear, but social media posting comes down to your audience. So who they are and where they're spending most of their time. So Sprout Social actually did a study a couple of years ago that said Facebook is really the #1 social media for most generations, from baby boomers to millennials. But if you're hoping to reach younger audiences, Instagram might be something you want to dip your toe into. Once you know where your audience is actually at and spending most of their social time, get familiar with that tool in the best way possible. Ideally, you should be publishing content that resonates with them. So for example, if you post a blog every Monday and Thursday, make sure that you're updating your social media on those days too, as you post new content to your website. And don't be afraid to reuse content that you've previously posted that's still relevant. So we are having unfortunately easy early winter in Iowa. So there's no shortage of articles from our local news providers and our local hospitals about staying safe in icy conditions as we start getting closer and closer to those negative zeros. As you dip your toes in, get to know the audience again, take time to use social media as a place to ask polls, ask for interests from your audience, ask what's kind of making them tick or what's on their mind. Those can make some really great opportunities to have meaningful content and drive meaningful conversations. And then again, health-related topics in the national news or in the local news. Obviously, we're in flu season, so any type of flu-related articles that are really hot right now. These topics are great ways to find new ideas and build content marketing assets that you may have missed along the way. And again, putting your brand out there as a potential partner for your healthcare consumers who are really looking to you for some of that information. And that's something you can do. As a last tip, make sure that you keep an eye on what types of social posts are most engaging. So if there's certain content that's really resonating or getting a lot of likes or comments, be sure to keep that in mind and keep driving that type of content in the future as your social presence continues to grow.
Fortunately, social media accounts make it really easy to see those types of analytics.
Yes, they're built in a lot of the time, especially in Twitter and Facebook. So you can really see kind of how things are going. And of course, obviously the comments and the likes coming in can give you some indication too. But yeah, a lot of them have built up their analytics over the years, which is super great.
Yeah.
Great. Well, as you are creating content and sharing it on social media, you might wonder how you can reach multiple audiences with one single piece of web content.
Is it possible?
We'll find out. I'm going to answer this question by stepping back a bit in the content development process. So before you even create content, you'll want to identify each audience you want to reach and what each audience's needs are, which you probably did in your content strategy that Erin talked about earlier. And then once you've done that, consider how much those audiences' needs do or don't overlap. After you've done both of those things, you can determine whether or not you actually need separate pieces of content or a single piece of content to reach those audiences. And finally, when you create a single piece of content for multiple audiences, I recommend optimizing it for whoever your primary audience is going to be, even as you include information for secondary audiences as well. All right, so we got some SEO related questions as well. Our first one was, are there changes in search that should shift our approach to writing website content? All right, this is something we're always trying to stay on top of. A lot of people have questions about this. One of the biggest things that's happening right now is Google is improving its understanding of user intent, or the goal that people have when they enter a search query. You may have heard of the BERT update, which is an algorithm that helps Google better understand natural language and conversational queries. There's not actually that much that writers need to do differently as a result of this. The best advice is what Google itself advises, which is to write your content for humans first. And that means following basic rules like providing the specific information that people are searching for and answering their questions, using the keywords that they use, and just writing in an engaging way that's easy for your audience to understand. When you do all of these things, you're setting the foundation for good content and SEO.
All right, and again, related to SEO, this is a tricky one. So as folks who work in digital marketing, we know that metrics can mean a lot of different things to a lot of different people, depending on the lens that you're looking at them through. So explaining this to folks that live outside of our kind of realm can be a little difficult. So how can we respond to stakeholders who are concerned about search results, even if their content is well written and fresh? It's a really great question, but ultimately we need to know what the stakeholder is searching for when they say this. So we've all put a query into Google and expect to see something at the top of the first page. So how they're searching could actually impact what they're seeing and why they're asking. So if they're inputting queries into Google like a doctor would, maybe using more complicated words like Celine mentioned earlier, they may not be ranking that high because those are really technical. You might be seeing a lot of health libraries or WebMD type content coming up. But if you're actually putting things in like a patient would, or using even regional or local keywords to try to find something close to home, that may give you a little bit better understanding of where you're really ranking. So the question really is, are they worried about ranking on page 4 or that they're number 4 on page 1? So some of those things can actually have a effect on that. It's also important to remember that fresh content doesn't equal good SEO. And well-written content, it's sometimes in the eye of the beholder. We're writers. We love our content. Every word that we write as a child, we absolutely adore it. But review and examine your Google Search Console results to see what keywords are using. Compare your page to even local competitors. You know, are you using some of those techniques we talked about, like subheads and bolted lists and easy to read health literate content? Those are really important features that you may have thought you hit the first time, but after second review, you could probably improve. And most importantly, keep yourself in the patient's shoes. So again, keyword research and knowing kind of the questions that people are asking depending at which stage of the journey they're on or what emotions they're feeling, that can help guide a lot of the content you create and something you can inform your stakeholder. If you've already kind of put those into consideration and you're still getting pushback, make sure that they understand the gravity of those approaches and why that's so important to the journey. And always reiterate the primary audience and the goals that you have to reach them. Beyond that, just know that SEO takes patience, which is a hard pill to swallow these days. SEO is not an overnight thing. It takes Google some time to check on the expertise, authoritativeness, and trustworthiness of your content. And that's a new algorithm that came out not long before BERT called the EAT or EAT algorithm. So it really wants to make sure that the content that they're delivering, especially if it's high ranking, is going to be the most valuable and authoritative and trustworthy to the user. So there's a lot of variables that can make that page show or not. And Google Trends, like we mentioned, is a great step to see if it's seasonal, if you're using the keywords people are using in your area. Other tools like SEMrush can give you an idea of where your organization ranks for a specific keyword or how that page ranks for that type of keyword. And remember that one piece of data is not going to give you the whole picture. So often we hear these vanity metrics like more hits and more clicks as a goal, but that's not entirely reachable and digestible. So consider readjusting your goals into what we call SMART goals. And I think probably everyone's heard of these. You know, what can you specifically track? What's your form of measurement? Is it achievable and relevant to your organization and needs? And what time box can you put around it for monitoring that success? Those are really integral into understanding how you can manage and metric page. And it's important to know and communicate that there's a lot of ways people can find information. It's not just coming up #1 on Google. So again, patience is key. Keep an eye on it, make adjustments as things go. We like to say the website's never done. It's always a growing organic piece of your marketing, but keep an eye on your pages. And as stakeholders bring those needs up, continue to look at that and have very important and real conversations with them so they understand what you're doing and why you're doing it.
All right, well, we're going to kind of shift back to internal questions for the last 2 questions here. How do I manage stakeholder requests for new content on our website? And when I read this question, it took me back to my former job in marketing and communications at a hospital. And I remember the consistent flow of requests for new website content. Many times the requests were stemming from quality, accreditation, or other legal requirements to have certain types of information on the website for the public. Not necessarily on the website, excuse me, but available to the public. But what that meant to my internal stakeholders was that we needed to put it on the hospital website. So unfortunately, the requests for new patient-focused content were few and far between, those requests. So this is a difficult situation to be in. It isn't easy to tell stakeholders that the content they want to add needs fine-tuning, or worse, it isn't appropriate for the public website. So here's some tips to help you with that. Establishing a governance framework that'll give you criteria and processes to have in place to help align with your website's purpose and goals. And that will also take the pressure off of you to accept or reject content requests because you have this framework in place. And starting that would include creating a website content request form that requires content needs to be submitted and detailed in a consistent and organized way. And then create a workflow around the form to document when requests come in and how they are ultimately handled. So make sure to share this process with your internal teams so that they can help comply with it and they understand the requirements. And then another thing that some of our clients do during a redesign is develop a core strategy statement for their website. And it gives them a content compass for where new content fits or does not fit into the strategy of their website. We can help our clients formalize this, and this can be used along with your content request form as well. And then another approach to keep your stakeholders engaged and get their message heard, but in a different way, may be to try thinking about redirecting their requests or finding alternate places for their content. Can they serve as an expert by contributing relevant, appropriate content for your blog, your e-newsletter or content marketing hub information. And that's some of the stuff that Erin talked about earlier. It's always great to have these experts who can write about that information, and then it is also available to the public as well. So for more information about governance, you can view our governance asset on geonetric.com. It's down at the bottom of the slide there. And then the last question for today is about updating content. So if you're overwhelmed by the need to consistently update your existing web pages and create new content, then you need to perform a comprehensive content audit. Yes, back to the content audit. We've touched on this before, but in case you are having trouble remembering it, a content audit evaluates the content you have, and you can put it into categories. You can use metrics, readability ratings, and other content strategy tools to assess the content that you have. And basically, it's a qualitative look at your content. And then you'll also want to complete a quantitative look at your content with a content inventory. So you know what types of content you have and how much content you have. And there are tools out there to help you with that as well. These two steps together will help you prioritize your most important online content and use your current assets more efficiently. So the goal is to reduce the time it takes you to maintain your website content, but still have that great content out there. So at this point, you'll also need to make some decisions about archiving, revising, and creating content. And that can be difficult when you have a lot of good content out there, but it needs to be the most relevant at the time. So most organizations end up with less content, but better content on their website after a content audit. And then long-term, you'll want to create a content governance plan to help manage, review, and maintain website content assets effectively for the future. And again, you can see some of those resources on our website.
Yeah, and when you're doing that content governance plan, one thing that might help is if you can get buy-in from somebody high up in your organization to support that, especially if you can tie your plan and your core strategy statement that you were talking about earlier to your organizational mission, then it's not just, you and marketing as marketing specialists saying, we can't put this on the website or we have to take this off. It's actually, you're saying that with the backing of somebody, maybe an executive in your organization, and it's supporting the whole organizational mission.
Good point. That makes it a lot easier for you.
Yeah.
So marketing expert in Lee Odden says, content isn't king, it's the kingdom. And I think that's a really fitting end to today's webinar. Content is more than words. It's about experiences, and experiences are what drive patients through their journey. So they're looking for knowledge, answers to their questions, and reassurance that they're going to get the best possible care for themselves or their loved ones. So how you create this experience, from the navigation and the words on the page to connecting things that make a unique and compassionate brand very accessible to that audience, impacts the patients and the healthcare in your community. So we really appreciate the questions that you asked us today, and we've got a couple of minutes left. I'm going to kind of look at Cole to see if that's okay. We did get a couple of questions this morning that I just want to address, and one of them was actually a really good one. To what extent, how soon is voice-assisted content going to become a digital disruption? So that, I love that word, disruption. So voice assistants are everywhere. Some of us probably have those pods in our house. We're used to doing it on our phone. If you don't want to be hands-free, you want to talk to your phone. It kind of goes back to the BERT update that Celine mentioned. So really, if you're writing good content, if you're writing content for an audience, you're using those valuable keywords, you're still going to get the benefits of voice search and things of that nature, because voice search is tying very closely into those search engines, like especially Google and Bing, that are already delivering some of those results. When you're looking at what the pods can do, that's still kind of something we need to monitor. There have been some studies out there. They're not really sure that patients are totally sold on providing or asking healthcare information on those pods, knowing what we know about, the quality control in the back end of those companies and how they're monitoring those conversations. So that's something we're kind of keeping an eye on in the healthcare industry, but it's good that you're asking that. And I would encourage you to continue to read what you can as more information comes out around healthcare and voice technology. We got 2 minutes left. Are there any free or moderately priced Grammarly-like tools that will review your text and make suggestions on how to make it less technical and more consumable? So I think Stella mentioned Hemingway app.
Yeah, that one's free. We like Grammarly too, even though there is a cost associated with that. There's some great tools in Word, Microsoft Word. As we mentioned earlier, there are free online plagiarism checkers. There are a lot of great tools out there and more every day on improving your content.
Awesome. All right.
So much for attending. Thank you for sending in your questions, and we will see you in December.